Hello everyone, welcome back to Medico. My name is George, and today we are back with a really special interview. It's about 2 years since we did our last interview, and we interview really special people who have achieved incredible feats so that it's inspiring, and we also learn from their experiences. And today, I have a really special senior, Dr. Gomathy, who's cracked the USmle and has matched into an internal medicine program at UAMS this year. And so, why I'm doing this interview is because a lot of medical students in India have no idea or think that the USmle is impossible to crack for an Indian medical graduate. And she is an example that it's not impossible and you can do it. So welcome Dr. Gomathy to this interview. So looking forward to hear from you.
Hi, George. First of all, thank you so much for giving me the opportunity to do this on an online platform. I've seen so many of your previous videos, and it's an honor to be here today and be a part of it too. So yes, I did match this year. I'm a medical graduate from Trivandrum Medical College, and I'm excited to be doing this with you today. So first, I did make a small PowerPoint because you informed me yesterday. So let me share the screen for PowerPoint. Okay, so my name's Gomathy Nageshwaran, and I am an incoming PGY1 this year in internal medicine. I did my MBBS from Medical College, Trivandrum in India. And I have basically targeted this PowerPoint to IMGs, that is international medical graduates, particularly IMGs from South India, I guess, because that's more easier for me to talk about, as because I'm an IMG from South India myself. And I have divided this PowerPoint into multiple sections, so that if you have a particular section you want to go over, you can just skip to that particular part of the video and watch that. Because I know that it can be very stressful and busy while preparing for the USmle. And so if you just want to listen to the answers to particular questions, you can do that too. So these are basically the topics that I plan to cover today in my PowerPoint. But if you have any other questions, we can always deal with that later. So the first one is why the USmle. So I saw that a lot of people ask me why I took the USmle route. So first of all, it's my personal opinion that as a clinician and a physician, it broadens your clinical experience going to another country or another place to pick up more of the medical knowledge that it's or the training that's given there. Because I remember when I was a medical graduate in India, I had never seen cases like cystic fibrosis. I had read about it in medical textbooks, but it was when I did my rotations in the United States that I could actually see how cystic fibrosis was being treated there and get involved with research on cystic fibrosis and all that. So definitely moving outside of your comfort zone and outside of your native place definitely brings you a broadened clinical experience, and it helps you grow as a clinician, definitely. So that will be the number one reason why I would say that you have to take training from multiple places as a physician. And second, the exposure to other cultures. So if as a medical graduate in India, I had not seen so many other cultures, like from other countries, and moving to the United States definitely gave me that exposure to people from other cultures and other countries, and it definitely broadens your perspective. So that was exciting, fun, and it helped me grow as a personality. And also learning to adjust to a different environment outside of your comfort zone definitely helps you become more resilient as a person. It allows you to grow as a personality, and I would not change that for anything. And the training in the United States is valid in over 80 countries, including India. So if you take your training in a residency or fellowship in the United States, it definitely allows for you to practice both in the United States and in India if you want to come back. And You can also go to multiple other countries with that training as well, and you wouldn't have to do the training all over again. This is as compared to the training in India, which is probably not valid in the United States. So if you've done your residency or PG training in India, then you will not be able to practice with that training in the United States. You will still have to do a residency all over again. Although your MBBS or medical school is still valid, the residency or PG training in India is not considered valid in the US. However, the inverse is true. For example, if you get your training in the United States, you can still come back to India and practice later. The other reason is some other reasons are there's a lot more research opportunities and quality improvements and other opportunities related to academic research, and so all of that is definitely another reason why you can go abroad and see how research and trials are being conducted there. There's a lot of research that's coming up in India as well, but comparatively a lot more opportunities may be seen in the United States, I guess. So like, for example, clinical trials, less than 1% of the world's trials are conducted in India, but definitely a lot more research is definitely happening in the US, and you can be a part of it by getting your training there. So that was something I was looking for. We can talk about it more in further upcoming slides as well. Another reason that I had was I do have family in the United States, so having immediate family there was definitely another motivating factor. And so everybody has their reasons why they take the USmle, but you will have to make up your decision for yourself. Then an overview of the pathway. So a lot of people did ask me about how the pathway works and everything. So a lot of this is available on online searching too. But just to give a quick overview, so the exam is in 3 parts. So you have the step 1, the 2CK, and 3. There used to be a 2CS, which is the clinical skills, but they took it down after the pandemic. And so what I wrote was the OET, or the occupational English test. And so the 3 steps are very long exams. They're 7 or 8 hour long, 8 hours long. And the step 3 is actually conducted in 2 days. And the step 1 has now become a pass or fail, whereas it was a score when I wrote it. In addition, you will need to be ECFMG certified, which is basically getting your license certified by the ECFMG as in verified. So other documents that you will need are some documents from your medical school, which includes the medical school performance evaluation, the medical school transcript, and the name. And if you have a name difference on your passport and your degree certificate or your medical school documents, then you might need some name verification documents as well. So most of these documents can be easily obtained by contacting your medical school, the academic section department. And with respect to the other things, well, you'll have to, for applying to the steps, you will need to follow a certain you'll have to go online to a website called the ecfmg.org, and you will have to go through the interactive web application, start your application for the steps there. You'll have to make a payment. And the process is like, you will have to obtain an ECFMG identification number, which is going to be valid throughout the process. And once you obtain that number, you will be asked to get an online notification of your online notarization of your identity. And once the online notarization is over, you will have to begin an application for whichever steps that you're planning to write. And you will have to pay an application fee, Once that is done, you will be able to download a Form 183. And this form you will have to submit to your medical school, and they will certify and send it to the ECFMG before you can obtain your scheduling permit. So some medical schools do this online on an online web portal, but a lot of medical schools in India still do it by paperwork. So you will have to contact your medical school to find out the exact process. So that is how you begin with the steps. Then it takes about around a month. It used to take around 2 months for the processing during the pandemic, but I'm pretty sure it's reduced now. So it's probably around 2 weeks for you to get the scheduling permit once all this is done. So once you get your scheduling permit, you can choose the months that you want to write your exam in, like, for example, an October to December slot, or a December to February slot. And you can write step 1 and step 2 in India or any other country. Step 3, however, has to be written in the United States. And the OET is conducted twice every month. You will have to just register for it at the earliest date, and it's valid for 2 years. So the occupational English test is it's just a test of your English knowledge in an occupational based setting. And so the next is the ECFMG certification. So for ECFMG certification, there's a lot of other documents that you might need. You will have to be done with the steps. You will also need a letter of good standing from the from your council that you've been registered in. For example, for us, it was the Travancore Cochin Medical Council. So you will need some documents like that has to be sent to the ECFMG, and then they verify your credentials, and that is how you get ECFMG certified, which is a certificate that comes to your house and will be required for a lot of the process. And the other documents, which I've listed on the slide, you can easily obtain it by contacting the academic section in your medical school. So once all this is done, you can begin applying for the match process, which you don't have to be actually done with all of these, but I was done with almost all of these before my interviews began. But a lot of people do take their step 3 much later down the lane. You can take your step 3 even after you begin residency in the first year of residency. So it is not mandatory to be done with step 3 before you apply for your interviews. And however, it will be certain that you will probably need to be ECFMG certified before you apply for the match, at least by match day, because a lot of programs require you to be ECFMG certified, and it certainly might increase your chances of obtaining interviews if you're ECFMG certified already. And most of the other documents, however, are pretty much mandatory for applying to the match process on the ERAS portal, which is the residency applications portal where you apply for your interviews. And then you have the interviews, which for me, I think the best part of the entire process, which is by far very stressful for sure, but I think the best part of the entire process of the interviews, because that's when you really get to meet people who have achieved high positions in their own fields, and you get to talk to them and understand how the system is, how different programs work. And I think that was definitely a very memorable part of my match process, because I realized how this entire pathway can be very, very stressful. But attending the interviews is it felt like an honor to me to have my credentials considered worthy of being interviewed at so many places by different people who have achieved so much in their fields, and to be able to talk to them. And I think that's something every candidate definitely can look forward to. And then you have match day in March, where you've matched and where you've matched, and that's definitely exciting, very exciting too. So that's basically the pathway in a nutshell. I know it sounds a bit overwhelming, but once you get done with each step one after the other, you'll be fine, and it won't seem as it won't seem as stressful once you're on the other side, I can assure you. With respect to the timeline, yes. So timelines vary for different people. I can tell you my story, but your timeline need not necessarily be the same. So my story was I finished my internship in April 21, and then I worked for 3 months because of the pandemic. And then there was some delays because of the pandemic. So I got my degree in October 21, and that's considered when you graduate. The year of graduation is taken as the year when you get your degree certificate. So for me, that was October 2021. And for me, for a variety of reasons, both personal and pandemic related, I could not apply for my USMLE steps until after I received my degree certificate. So I took my step 1 on in January 22. And 2 months later, I took my step 2. And 3 days later, I think a couple of days later, I took my OET. And I did my rotations between June and September 22. And I took my step 3 in between my rotations in August 2022. And so this was a pretty fast way of doing it. Most people take a much longer time. So what I did was I basically finished all my steps and my rotations in an 8-month period. And I think that's probably one of the fastest timelines that you can follow. A lot of people take a lot more time to do the entire process. It entirely depends on your own capabilities. For me, I just wanted to apply to the cycle, and I was prepared to do anything just make sure I would be eligible for the cycle this year and the match the cycle. So I didn't want to waste any more time. I had actually initially written the NEET PG, which is the exam for postgraduate training in India, and then there were some delays with the counseling and everything, by which time I had applied for USMLE as well, and that fell through. So once an opportunity came by, I just decided to grab it, and that's how I began with writing my step 1 in January, and then finished with my last step in August. So depending on your own capabilities and what targets you wish to achieve, you can extend this timeline in any way that you would like. For example, if some people do write their step 2 before their step 1, that's entirely doable, particularly because step 1 has now become pass or fail. For us, it was a score on step 1. So my scores would be, on step 1, it was 251, step 2 was 269, and step 3 was 233. So now it's basically your step 1. Step 1 doesn't have a score anymore. It's pass or fail. So a lot of people do take a longer time to prepare for step 2, but I think the very minimum that you can prepare for step 2 would be around 2 months. So I think that would be my timeline, but depending on how strong you feel in your preparation for the USMLE, as well as what targets you want to achieve, you might want to change the timeline in any way that you would prefer. So that could be like if you set yourself targets of 250 plus or 260 plus on the step, and you don't feel confident enough in your final year subjects or your first year subjects or whatever, so then you might need a lot more time. But 2 months should be okay if you felt perfectly confident in your preparation and you just wanted to be done with it faster and sooner. So now we are halfway through the PowerPoint presentation. So this is one of my favorite quotes from Jane Eyre: "Your will shall decide your destiny." And I think that pretty much sums up what the USMLE process is like. So if you are determined to achieve something, I'm pretty sure you will be able to achieve it, provided you work in the right fashion. And definitely, whatever you're destined for will definitely come to you. And so the next question that I wanted to deal with was how to build up your CV. So, so this is basically just what I saw from my experience and the experience of a few friends that I met along the way. But in general, your CV, the things that matter on your CV as an IMG would definitely be scores, your US clinical experience, letters of recommendation, research, and there's some other stuff as well. So your scores are basically going to get you through the threshold. So a lot of programs will have screening criteria depending on scores. So 250, 260 plus, different programs have different score criteria. Some of them would have already written it up on their website. You can do that while you're researching programs. So scores are definitely going to get you get you through the threshold and bring you the interviews. But once you get the interview, I think a lot more depends on the other parts of your CV and how you perform in an interview. So the second thing is US clinical experience. So I have a separate slide on US clinical experience, but I think it definitely does bring a lot of it definitely helps in boosting up your CV in a variety of ways, because when you get to do your US clinical experience, you can also get involved in research activities, and if you work really hard, you can get very strong letters of recommendation. I was lucky to have obtained great letters of recommendation from the professors that I got to do my rotations with, and I think it definitely boosted my CV by a huge. It made a huge difference to my CV and as to what interviews I obtained and all that. So. And then with other factors that can help build your CV, so there's a lot of things that are that there's a space to put in your ERAS, the residency portal CV form. So one of that is medical school awards. So if you have a strong academic performance in your medical school, you can definitely put that up on your CV. This includes gold medals, distinctions, and medical quizzes. All of that definitely contributes to your CV as well. A lot of programs and program directors do know what gold medals mean in India, and I think it was definitely something that that'll help you build up your CV. And next is the year of graduation and home country experience. So a lot of programs do have YOG cutoffs, which means that you're more likely to have more interviews or be able to apply to a larger set of programs if your year of graduation is less than 5 or less than 3. So if you're a fresh graduate, that definitely helps. But even if you're not, there are a lot of programs that you can still apply to, and you can still get matched. Just that if you have a recent YOG, it's definitely a positive factor, but that doesn't mean that older graduates can't match or anything either. I have a separate slide on that as well. And if you are an older grad, or if you're not a recent graduate, then your home country experience, including a residency training in your home country, definitely is a boost. I've seen people match without USCE. USCE because just residency training in their home countries, and so it's none of this is like absolutely mandatory. A lot of people match without excellent scores but great research, and a lot of people match without research but great scores. And so it depends entirely on you and how you portray yourself and how you build up your CV in general. It's an overall personality and overall CV that counts ultimately. And working on your personal statements and other aspects of your CV also definitely adds up to it. So about the US clinical experience, so if I were to give an opinion on this, so I would definitely say if you get an opportunity to do US clinical experience. So what I did was a USCE as a graduate. So I could only do observerships and not hands-on electives in university-based settings. So most of my rotations were observerships. So at many clinics, you can still get to do what they call hands-on electives and stuff. But mostly, if you're a graduate, you're allowed to do observerships. So anyway, about the US clinical experience, there are multiple types of US clinical experience that you can apply for. There are hands-on electives as well as observerships, and there are rotations at universities versus clinics. So I think by far the the best ones would probably be hands-on electives at university programs. But what I did was observerships at university programs, and they were pretty awesome too. And USCE is can give you an idea of how US healthcare system is like. So when you're starting out with residency in a new healthcare system, it definitely doesn't come out as a shock because you've done rotations before. So it also allows you to get some time for cultural adaptation. Moving from a new country, moving to a new country is not easy. So definitely that cultural adaptation is definitely a learning curve, and doing rotations in the US definitely helps you get adapted to the culture better, both in the work settings as well as otherwise. And it helps you build contacts for sure. You can get to talk to a lot of people who are in very good positions in the field, and you can express your interest in their program or in the field in general. And USCE is how you obtain letters of recommendation from professors in the US. So letters of recommendation are very important when it comes to building up your CV, and the portal allows you for uploading up to for submitting up to 3 or 4 letters of recommendation per program that you apply to. And when I applied, I had applied with 3 letters of recommendation from professors in the United States, and 1 letter of recommendation from my professor in my medical school here, the head of the Department of Internal Medicine. So that is how I applied. Basically, when you work with a professor for at least 3 or 4 weeks, you can ask them if they would be willing to write a letter of recommendation for you, and then you send them a link, and they upload their letter of recommendation onto your portal. Sometimes, most of the cases, it'll be waived, so you cannot see what's written on your letter of recommendation. But and that definitely strengthens the LOR. But it definitely is a boost to your CV to have letters of recommendation from people who have known you well. And then USC also allows you to get involved in research. There is a special section on the ERA's portal that allows you to describe all the research and presentations that you've done, both in medical school and after that. So getting involved in research is another opportunity that you will get when you go to the United States to do clinical rotations. And most of the hands-on electives you can only apply to if you're not graduated yet. So that is something you have to keep in mind. Once you graduate, you can basically not apply for hands-on electives in universities. So you'll have to keep that in mind when you're applying. And as to applying for US clinical experience, so you can email professors directly sometimes, and sometimes you will have to search the program website. They will have a link and a document that you can fill out and send to the coordinators, and that is how you obtain US clinical experience. With respect to research, so research is definitely the icing on the cake when it comes to applying for the USmle match. And you can get involved in research both in your medical school and when you're going for your US clinical rotations. So the way to go about it is basically when you're in medical school or otherwise, just reach out to your seniors and professors, ask them if they can get you involved in research that they're already doing. A lot of them might be doing thesis, case reports, all of that. So if you ask them if you can be involved, they would be more than happy to help most of the time. So that is one way you can get involved in research. That way, even in medical school, you can get involved in case reports or cross-sectional studies, or get involved in projects that other people, seniors that are involved, that are doing other projects, and then you can actually present them in conferences in India or locally, and that will definitely be an additional point on your CV. And the other thing you can do is apply for research positions. So this is not something that I had done, but definitely that is something you can explore. So a lot of programs, a lot of top tier universities in the US taken a lot of international medical graduates as research trainees. They sponsor a visa, and it's most likely to be an unpaid position, but a lot of them are paid as well. So you will have to search for these research positions and apply for them. There might be an interview process for the same, and then you spend a year or more than a year doing research with that institute, and that will be a huge boost for your CV. A lot of IMGs do get matched in competitive fields and competitive specialties that way, and it definitely opens out your opens out your world to a lot of competitive positions as well. So that is definitely something you can explore. And the variety of research that you can get involved in, case reports are definitely the fastest way to get involved in research. It doesn't take a long time to get involved in case reports. Once you find a good case to write up on, then a lot of people do systematic reviews. It takes longer, but it's definitely doable, particularly if you've already graduated. And case controls and cross-sectional studies, they are also pretty much doable if you take initiative to do that. And yes, taking initiative goes a long way. So if you have interest in a particular topic, then you can go and talk to seniors or professors, ask them if you can get something done on that, and that's how you get started with research in medical school, I guess. At least that's how I did it. And then you can present these research projects that you do at presentations and at conferences, both in India, and sometimes even you might get the opportunity to present it in the United States. And with respect to publications, as long as you get published, that should definitely be a huge boost to your CV. It helps when it's PubMed indexed, but not always can you get PubMed index publication done. But whatever it is, whatever research you've done, if it's well worth talking about, I think it definitely should be published, and you should definitely go ahead and try for publications. The next is something I wanted to talk about. It's the struggles as an IMG, as an international medical graduate moving to the United States. So that's definitely something that's very underplayed and very much not so talked about. So as an IMG, there will be struggles for sure. First of all, finances. It is going to be very expensive to explore the USmle route when you compare it to taking postgraduate residency training in India. So in India, you just have to apply for one exam. It doesn't cost a lot, and you have to just pay for whatever preparation you're doing. And sometimes, many of those times, those preparations can even be offered to you for free, or you might be able to get it at a discount and stuff like that. So definitely finances will be an issue, will be a huge factor. But I think ultimately it's quite worth it because it's more like an investment. So if you have to broaden your horizons, go abroad, then you will definitely have to make a little bit of effort initially with respect to how much you'll apply for the applications, for payment for the exams, payment for applying to the programs, and all the other technical stuff that you will need And doing rotations in the United States is definitely expensive. Going to the US to write step 3 is going to be expensive. So in some respects, it helps if you have a family or contacts there, but a lot of people do it without having any sort of family or contacts. You will make a lot of friends along the way, so they will be able to help you in a lot of ways too. The second is homesickness. So initially, at least for the first time when you've been to a new country, when you're going to a new country, you might face a little bit of homesickness. It may not be evident initially, at least when in the first month you're just about exploring everything, you're having a lot of fun. But after a couple of months, it definitely can be difficult to deal with, especially with the homesickness and missing Indian food and all that. But to be honest, most places in the US also have a lot of Indian restaurants. They have a lot of Indian societies. And I remember when I was doing my rotations in a very rural part of the United States, I got invited to celebrate Ganesh Chaturthi at an Indian society, and that's a really nice moment for sure. I was taken to a lot of Indian restaurants. I met professors who took me out for one of my professors actually took me grocery shopping once, and so that's a nice gesture. And coming to a new country to have that sort of welcome is definitely something that boosted my motivations to work in the US. And you will have a lot of fun in the US for sure during your rotations, but because you're exploring a new country and meeting new people. But homesickness can definitely happen, but you will eventually learn to deal with it. Just keeping an open mind to meeting new people, understanding other cultures, and going out in general and putting yourself out there, that definitely helps with most of the struggles of an IMG. And one thing to keep in mind is that there will be a learning curve. Learning curve is adjusting to a new culture, adjusting to a new environment, adjusting to a new work situation, all of that. And I'm pretty sure I'm going to face the same learning curve when it comes to joining residency as well. But the important thing that I sort of learned from my rotations is that you have to keep an open mind. You have to learn that there will be you have to accept that there will be a learning curve, and learn to accept things as they come by, and that will definitely help. So another thing that most IMGs struggle with is timelines and priorities. So definitely it takes longer to follow through with the USmle process as compared to just writing an exam and joining in a couple of months when you compare it with the Indian medical residency application situation. So the timelines and priorities, a lot of people take more than a year to apply for the USmle. It takes at least a year for sure. And so a lot of priorities can definitely change. Your family situations might change. Many things might change. But like I said before, if you have a will, your destiny will follow. And another thing that IMGs struggle with is visa-related delays, particularly with the pandemic. I'm pretty sure a lot of people face visa-related delays. First of all, you will have to obtain a B1, B2, or a tourist / short business trip visa when you're trying to apply for step 3 or trying to do your rotation to the US. That can take a long waiting time in itself. And once you've matched, you get to apply for a J1 or a H1 visa, depending on whether you have already completed step 3. So if you've already completed step 3, you're eligible to apply for H1. And some programs do not offer H1. Most programs just offer J1. And there are a lot of programs that do not sponsor visas at all. So there will be a lot of visa-related delays. But eventually it will work out. Just keeping a positive attitude and keeping an open mind sort of helps to get through that. So the next topic that I wanted to talk about is matching as an older graduate. So definitely, I matched as a recent graduate. So this is not something that I experienced, but I did get to meet a lot of older graduates who matched as well, and I'm pretty sure it's definitely doable. And why I wanted to talk about this is because a lot of people do ask me whether it's a huge disadvantage being an older graduate or not. Well, it definitely is a plus point if you're a recent graduate because you get to apply to a larger number of programs. However, if you are an older graduate, you can still match at a great program. And that in that respect, home country residency can be a huge boost if you have one. Otherwise, work experience in general as medical officers um, also can be added onto your CV as work experience, and definitely getting more USCE helps. Trying to work in clinics or volunteer um, in institutions in the US, helping out with the system in some respect, especially if you already have a visa, that helps too. You can apply for other positions in the US the other paid positions in the US if you already have a work visa. And so those are definitely things that you can look into in as far as gaining work experience is considered. And it definitely is important to play to your strengths. So instead of worrying about your year of graduation, you can definitely play your CV to your strengths, that is experience and research, and boost all that up on your CV. You can try to gain more experience both with respect to work experience in India as well as work experience in the United States. You can try getting involved in additional research. You can start working on systematic reviews on your own, or with or by going after by asking help from seniors or professors. And you can try presenting them at conferences in the US. And it would help to apply wisely because a lot of programs do have written cutoffs on year of graduation. That is, they will not take graduates whose year of graduation exceeds 3 or 5 years. But most of the time, this is a soft cutoff. So it's not. Many of the programs may not. Uh, most of the time, programs look at your CV as a whole and an overall performance in general. So if you apply wisely, a lot of programs will be very willing to take you in. And networking definitely helps, I guess. So getting contacts, getting great letters of recommendation also helps. This is just talking from my experience, and now that I've reached the other side, and there's a lot that I may also not know about a lot of these topics, but working from my experience with the match in general, this is what I think would be my opinion on how to work as an older graduate. And so there's another thing that I wanted to talk about and that is if you go unmatched. So I applied to only one cycle and I matched. So, but it may not always be the case for everyone. So I wanted to talk about what to do if you go unmatched. So first of all, yes, the match is very uncertain. You do not know until match day whether you've matched or not. And there are pre-match positions that are sometimes offered, but mostly most people go by the match route, and definitely until match day you will not know whether you've matched or not. So there is an uncertainty throughout the entire process, which is definitely nerve-wracking. But just remember that just because you've not matched doesn't mean you have to give up on your USmle dreams, and it also doesn't mean that you are not worthy of it. Just never give up and allow yourself some time to think about what could have gone wrong and assess avenues for improvement. So if you lack research, then try to get involved in research, apply for research positions. And if you think you didn't have any clinical experience, then you can apply for observerships or other clinical experience avenues. And once you get those rotations in universities or other places. You can build a network, you can get in contact with people, you can get involved in research, and those things can definitely help with improving your CV. So, and also once you've done with the match cycle, once you know how things work, so you will definitely be able to write better personal statements and present yourself in a better way for the next time. So nothing's lost in my opinion. Just make sure you work from where you think you are, and make sure that you're going upwards. And another thing that can definitely help during the match is to get a match buddy. I was lucky enough to find someone who was very supportive throughout my match process, and we matched together at different places. But it definitely helps to have a match buddy to vent your frustrations out to get further information about anything. Like I remember there was when I was preparing for step 3, I did not know about one particular information resource, and she was the one who told me around a week before my exam that such a resource exists and that I have to explore it. So that definitely helps in a lot of ways, and pretty sure it also keeps your sanity and emotional balance up. It helps relieve a lot of stress. So getting a match buddy it can definitely help if it's someone who's very supportive. And if you already haven't finished step 3, definitely finish step 3 before your interviews. And although step 3 isn't mandatory, you can take step 3 after you're matched in first year of residency. However, doing step 3 has sometimes increased interviews for some people, especially if the scores on step 1 or 2 are not at par. Step 3 would definitely be a boost. And step 3 can also make you eligible to apply for a H1 visa if you want to take that. And step 3 would definitely give an additional boost to your CV, because it shows that you will not need to take additional time off in the first year of residency to prepare for step 3. And so that's one thing off. And definitely it reduces your stress levels because you've already done with all your steps. So, and last but not the least, stay motivated, because the stars are already aligned for you, and if you work hard, you will definitely be able to make it. It is entirely doable. Just make sure you're working in the right direction, and you're putting in the right sort of efforts. Most of the time, it's just about building your CV in the right fashion. Like I said, the most important things that I think showed up on my CV was scores, US clinical experience, research, letters of recommendation, and medical school performance. So if you have these 5 things, you should definitely be a good candidate for the match. And if you think you're not strong on one of these aspects, you can just work on that aspect and improve upon it. And that's what I think made all the difference: working in the right fashion, making sure you're making the right sort of contacts, and definitely making friends help. And yes, I think if I end this presentation without saying that when I started out with the process, I was very nervous. I did not know much about it either. I wasn't sure if I would be able to do it, and whether I was just I was spending a lot of time and effort on something that was so uncertain, and it was making me nervous too. But I remember that there were a lot of people who helped me throughout the entire process, which includes seniors from my medical school, professors from my medical school, and the professors that I work with in the United States, and a lot of people on my personal end as well, my friends and my family, my match buddies. So all of that definitely is a strong network to fall back on in case anything goes wrong. I knew that they were all there to support me and work with me through it. So that definitely helped, and that definitely helped me get matched. So a network is definitely important. So I think that's all that I have prepared on my slide today. So now we can move on to the questions, I guess.
So that was a really amazing presentation. Like I personally didn't know that you cracked the whole thing in a span of 8 months. So I guess that should be the title of the video. How to crack USC in 8 months. So yeah, that's really I've never heard, like usually I've heard people take a long time, and so that's really, so I've written a lot of questions and it might be in a total bizarre way because I wrote in a single page, so there won't be any order. So bear with me for that. Okay, what are the cons of doing abroad? So you talked about the pros and all. So one, yeah, you told about homesickness, but any other cons of doing abroad?
I mean, there will be pros and cons to working in any environment for sure. Like there are cons to working in India, there's pros to working in India as well. And just like that, moving to the United States also has its cons. You will be definitely away from family for a long time. There will be the homesickness situation, and there are other aspects, technical aspects as well. The healthcare system is there's a lot of financial aspects to it, like insurance-based prescription deliveries and stuff. So those are things that are very different from India. Like in India, we don't work on the insurance system basis most of the time, at least in government hospital setups. So that is something I would say it's a little tricky to navigate through when you're in the United States. But overall, as a physician, when you're in training, I think it helps to move out of your comfort zone, and moving to a new country is definitely going to provide that additional boost to your training as a clinician, because then you get to see a lot of things, like other cases, other diagnoses, and things that you've not seen before when you were in India. You get to explore a lot of cultures, and definitely it allows you to grow as a personality. So I would say the pros definitely were more for me when compared to the cons. So
yeah, exactly. Those are really great points. So how much, like approximately, how much cost would it take for a graduate to go to the US? The whole process, like many of them, like they drop this in the first second itself because they think it's too costly. Like they want to go abroad, but PLAB seems like a more cheaper option, and USmle is a really costly option. So like they've heard it costs about 20 lakhs and all that. So they don't have the finances for the system. So like, what is the rough approximate cost for a person to go to do this whole process?
Okay, first of all, with respect to finances, that entirely depends on who you are as a candidate. Okay, so there are people who have matched without US clinical experience as well. Personally, I have known them, and they've never been to the United States except to take their step 3. So obviously that it decreases the finances by a huge margin if you've not done your US clinical experience. Then also the amount that you spend on US clinical experience is very varied. So if you're staying in a place where you have family, then definitely your expenses with respect to food and accommodation definitely reduces. So what amount that you spend on US clinical experience is very much varied depending on what contacts you have, what sort of USCE you're doing. Some of it is paid and some of it is free. So most of the observerships that are offered in university programs are often free. So then you will not, the only thing that you will be paying for is your rent and accommodation. And depending on how much of a comfort zone you want to be in, you can stay at a small Airbnb and make do with a lot of less expenditures, and or you can stay at a high-end place and spend more money. So that is very varied for sure. The US clinical experience part is definitely varied, but definitely there is a lot of it definitely costs some amount of money to apply for these exams. I believe that all the 3 steps and OET altogether cost around 5 lakhs or so in Indian rupees. So that's the amount that it takes just to write the exams. Maybe a little bit over that, but I believe it's around $6,000 to write all the step exams, apply for OET. I might have to confirm this, so I will send a message when I'm confirming this. But around 5 lakhs is how much it takes for the exams alone. Then in addition to that, you might have you might want to buy some resources like UWorld or First Aid, and those are the books that we use for preparing for USmle tests. So that's a small amount of money. It's not too much depending on how long you're buying UWorld for and all that. So that might be an additional few $1,000 maybe. And then US clinical experience is very varied. It can cost anywhere between like 5 lakhs, or you're doing research for extended 1 year or something. That will be much more on top of that. So altogether, I think 20 lakhs would definitely be a doable budget. Like most of the time, it's an average sort of budget, but then again, it varies completely. It's like if you do 1 or 2 research years, it might cost you more. But altogether, what I would say is that it's an investment, and you will definitely be able to pay this back down the lane. And compared to us IMGs, medical students in the US have a lot of debt too. So everybody builds up a little bit of debt, because when you're getting into medical school, it's going to be expensive. So initially it's like an investment, but eventually you will get it back. So when you start working, hopefully. So
yeah,
so
cool.
I am pretty much broke in one respect, but but I'm at least starting out to residency soon, and I'll pay my parents and my sister back. So that'll be okay.
My question is like, now you told it's the pass and fail system, right? So, and I've read about it that it's gonna make like foreign graduates, their leverage decreases, because usually our students get higher scores, and that's how they shine out compared to the others in the matching process. So when it's pass or fail, that leverage goes down. So for you it was marks, right? So in the coming years, so how would it be even tougher for an IMG to get into US?
So first, when I wrote step 1 in January 2022, I actually took the step 1 week before it became pass or fail. So my match cycle actually had candidates who had written both pass or fail, as well as candidates with scores. So more of the candidates were ones with scores, definitely, because we had just changed to pass or fail. So in all respects, I mean, I would say that having a good step 1 score was a leverage for international medical graduates previously, but now that it has changed to a pass or fail, I guess what matters is your step 2 and step 3 scores maybe, and the other aspects of your CV, which you can definitely build up on. So it's not going to be like just because you have step 1 has become pass or fail, it's impossible to crack the USmle route. It's not just the step 1 that matters, first of all. Your overall CV, your overall personality that counts when it comes to the match. So and in all respects, IMGs do match every year at a really good percentage. So I highly doubt that just because step 1 has become pass or fail, it push IMGs to that much of a disadvantage. It just means that you will have to work on other aspects of your CV. That's the only thing that it means.
What are actually tested? Like I have heard like USmle step 1 is your first and second year topics and a bit of psychiatry and stuff. And so what comes in step 2 and step 3, and what are the resources you used for all these 3 steps? Just you can be specific, like use first aid, sketchy, whatever, so others can also know about it.
Right. So first of all, yes, what you said was somewhat correct. Step 1 basically tests your first and second year topics. When it comes to the Indian medical school syllabus, yes, the first and second year topics mostly, but it also has some aspects from psychiatry, ethics, and stuff that we do not usually cover in first and second years here. But you can quickly learn that up when you're preparing for the exam. And step 2 basically tests the final year topics, more clinical reasoning based. And however, there's some overlap between the 2 as well. And step 3 has an overlap from both step 1 and step 2. It's a 2-day exam. The first day you have like a multiple choice sort of questions based on all the stuff that you've learned in medical school. And on the second day, you also have some additional clinical case-based scenarios, and that has a separate. You might have to put a little bit of effort preparing for clinical simulations. So it's basically like a simulation of a clinical case, how a patient comes to you in a clinic and everything, and how you would send the lab panels and how you would manage the case and everything. So there are resources to prepare for that as well, and so that might require a little additional preparation with regards to step 3, because otherwise step 3 is basically just what all you learned for step 1 and step 2. That's why once you've done with step 2, I think it's easy to do a step 3 in a matter of like a couple of months later. It's not that difficult. But taking step 3 before your interviews is entirely up to you. You can take it later on. Unless you want to apply for a H1 visa status, you don't have to apply. You don't have to take step 3 before the match either. So that's with regards to the exams in general. With regards to preparation, so for step 1 or 2, I guess I mostly use first aid and UWorld. So UWorld is a subscription-based question bank, and it's very useful. It entirely gives a very good simulation of how the exam is, and you can take it on like for as long as you want, like for 2 months or 3 months. So for step 2, I took UWorld for 2 months, and I also used first aid. And that was basically the resources that I used for step 2. But for step 1, I think I tried a bunch of other resources as well, just to build up my foundation. For example, I definitely used some of Kaplan's videos. I definitely used Boards and Beyond. Boards and Beyond a lot more, because I think it was faster to use Boards and Beyond, and I tried to do this in a span of time. So for step 2, I used Boards and Beyond a little bit, and first aid mostly, and UWorld. So the way I used to do UWorld was, once I finished a topic like CVS or something, I would do the UWorld section on CVS. I would try to finish up whatever section that I've done, and then after a month or so, you would have been done with all the questions available on UWorld. So after that, you can just redo whatever you've made mistakes on, and then just do the they have a complete health assessment as well, which is like the real exam. So that's what I did after like 1.5 months. So just before, like 1 week before your exam, just take a self-assessment and make sure you're reaching target goals. So I wanted a 250 plus for sure. So I took my self-assessment. I was sure that I would get something around that range, and I got a 269. So that's how it works. So just make sure you know what your capabilities are. So I knew I felt kind of strong on my final year subjects. So once I started doing UWorld, I started understanding that I was okay. I was doing okay. So then I knew that I could do it in a couple of months. So I did a self-assessment between like just a couple of weeks before, and then I just applied for the exam. So that is how I did it. Just make sure you know your strengths and your capabilities well, and you play to it. So if you're weak in one particular area, for example, ethics was very confusing for me at first, because we don't do that here. It's a different sort of system. So then I started working more on ethics. Like I would try to get additional questions or additional information on that. And then eventually you get the hang of it and you start working out.
And just in short, like how many times, if you write one exam, you can't attempt it until like 3 years or something, right? Something like that is there, right? Is it there?
So I think what you mean is that the step 1 score, like if you've written it once, it's valid for 7 years, and
Okay.
So after 7 years you will have to take step 1 again, is what I believe. But otherwise, if you pass the step 1, you cannot take it again. But if you failed, you can take it again, but it will count as a reoffense. And basically, if you pass once with a score, then you cannot improve upon the score, if that's what you're asking.
Yeah, I'm asking. So if you didn't match, you can only work on your research and your clinical experience, right?
Yes. So if you've already written your steps and you've got a score, you cannot change it further. So if you, by chance, if you have a low score and you're not feeling satisfied with it, there's nothing you can do about it. But there's a lot of other stuff that you can work on with respect to clinical experience or research. So you can definitely work on that and boost your CV. So people match with a variety of scores too. People on the higher end of the scores with very high scores match, and people with average or below average scores also sometimes match for various reasons. So.
And the step 3, it's completely written, right? Even the clinical scenario, like there's no patient. Is it like that? No.
It's all computer based.
Okay, fine.
Step 3 is also computer based.
And in the CV, only academic achievements matter, right? It doesn't matter about your other co-curricular achievements, right? Only academic achievements matter, right?
There is a space on your CV where you can write about your extracurricular achievements and your hobbies. So all of your other activities definitely come in that section. For example, for you, George, your YouTube channel would definitely come on your extracurricular hobbies. So yeah.
So coming to, you told about work visa, and for an older graduate, so work visa means they are not able to work, right, with the Indian degree and Indian post graduation. So I don't understand the work visa part.
Okay, so if you, what I meant is, as an older graduate, if you're already eligible to work in the US, then you can apply for positions other than residency training programs. Like there might be some other. Well, I actually didn't go this route, so there's no way that I can definitely give you an answer to it. But there are positions like scribe positions, research positions, and stuff that you can apply for if you already have a work eligibility.
So yeah, I guess that answers all of it actually, and I'm sure a lot of our viewers also got a lot of their answers. And I really like that quote from Jane Eyre, which about your will shall decide your destiny. That's really true. And you have shown that. Yeah, you have shown that, because it's a really unconventional path, and usually, like, most of the students don't even like actually look at this as a viable path. Most of, like, I guess from each batch there might be only one or two students who actually go to the USmle path, in our college at least, right?
Yes.
And
yes, definitely. So for me, I think at least in the beginning, I was also very confused. Like I mentioned before, I was unsure whether I could do it, and I always wanted to do it for sure, but it just seemed easier to stay in India and take a residency training here. But it seemed so uncertain and seemed so I felt like it wasn't doable at first. But then I guess there were very supportive seniors who helped me, and all the professors who helped me, and my family too. So I just wanted to, do pass the same on. Like I wanted to help people too, so that's why I wanted to do this video. Because my seniors helped me, and I want to help whoever's there.
I'm sure this video is going to help a lot of students, because everybody is like scared of asking people. So if there's a video available, anybody can come and view. So thank you first of all, and for taking the initiative, and also being ready to do this video. And I know you're busy getting ready to go to the US. I'm sure you're really excited to
get
back.
More, like I'm a lot nervous too. It's gonna be a ride for sure, an adventure for sure.
So how are you spending time nowadays? How are you spending time nowadays?
Most of the time, so last few months, this after I matched, most of the time has been busy with the visa related processing most of the time, and then there's the onboarding stuff with respect to my program. So where I'm going is Little Rock, Arkansas. So I have to figure out like apartments and stuff like that. So basically that's what I've been doing this couple of months, mostly just that. And it's gonna be an adventure for sure, but I'm like hoping it'll be okay.
Again, wishing you once again all the best from everybody here, and we'll see again sometime soon, right?
Yes, and definitely if somebody has any other questions, they can post it on the comments. I'm more than happy to help out. And additionally, to everybody who's still working for the match day, it's very, very exciting. You'll get to know where you've matched, where you're going to spend the next 3 years. It's something to look forward to. So all the best for everybody who's preparing this year. And I'm more than happy to help if anything.
Do you have a match video with you? Did you take a video of you opening
the No, it was just I was super anxious. So it's actually over a period of a week. So on the 13th of March, you know whether you've matched, and then like half your anxiety is gone, so you've like matched at least. And then on the 17th of March, you know where, and then it's a nerve-wracking sort of week. So yeah.
Okay.
But it's exciting for sure.
Yeah. Okay. So then, have a great day then. Thank you for coming. Bye.
Yeah. All right.